I'd next like to bring Dr. Jane Witman up. Dr. Witman is a board certified in emergency medicine and medical toxicology. She's an expert also in the field of substance abuse, and she sees firsthand the impact of addiction at the Aurora Bay Care Medical Center.
I've been in Green Bay 18 years, and I trained in Indianapolis. And as an emergency physician and then as a toxicologist, 5 years, Indianapolis was a big heroin town. We saw a lot of heroin. When I moved back to Wisconsin and came to Green Bay, literally 10 years, no heroin, none. We would see narcotic overdoses, but heroin was not a part of our landscape. And the question is, why now? And there are some answers towards that. And I think that's important for prevention and also for treatment. And so I'm going to go just a little bit through history, just briefly. It was actually 2001 when the Joint Commission, which regulates hospitals and decides who gets paid for Medicare and who doesn't, decided that we had a fifth vital sign. It's not just your temperature and your pulse and your blood pressure. It is also your pain level. And so everyone, whenever you go to the doctor, they will say, and what's your pain level? See, this scale is a 1 to 10. Is that acceptable? And that became something we all measured. And as that got measured, we began to prescribe more. As the sales of prescription drugs went up in pill form, what we found over the next 10 years is that prescription drug abuse, pill form, skyrocketed. So at one point, doctors were encouraged to treat pain. We start handing out scripts. Pretty soon, people like it. They start taking it. Now they want more. But when we quit prescribing, you have people who've been abusing pills, which were easy to hide, left no marks. All of a sudden, they're addicted. Heroin is cheap. It's quite plentiful now, and it gets them high, and it prevents them from going into withdrawal. Most people do not start using heroin. And so that is what the crux of what I'm going to talk to you about as a physician in the emergency department. 99% of the Vicodin, or the hydrocodone, which is produced in the world, is used in the United States. Why is that? 80% of oxycodone, which is Percocet, is used here. We are a pill nation. And so I'm going to ask every one of you, one of the things you do when you go to the hospital is if the doctor says, are you okay with your pain level? Think before you accept a narcotic prescription. I don't want anybody to suffer, but quite frankly, I have people asking for narcotics for sore throats, stubbed toes, ingrown toenails, a cut on their finger, a minimum bump on their head. We have gotten to the point where I think some of us feel we should feel no discomfort at all, and that is a dangerous place to be. The more narcotics we take, we actually change the physiology of our body. We downregulate, or we upregulate more pain sensors because our body's like, wait a minute, all these sensors are full. We need more. So when the narcotic is gone, we hurt. We actually ache, and that's part of the withdrawal syndrome. Even after 2 doses of a narcotic, when you come off of it, you'll get rebound headaches. You will actually have more joint pain. Narcotics are not just painkillers. They make you feel good. Some people, it's a mood elevation. Others, it's euphoria. Some, it's numbing of emotional pain. But there's a price to be paid. And I think our society is just getting to the point where we're realizing what we've made by just essentially medicating everyone who complains of any discomfort at all. Pain should be treated, but get rid of your extra pills. I don't want teenagers to get them. I don't want anybody to get them. And if I'm looking people up and I say no, you know, it's not a popularity contest. I'm not going to put any pills on the street that can fall in the wrong hands if I can help it. All right?